Hi, Paul Sack is Good News Planet. I'm speaking with Allison Paquin. Hi, Allison. How are you?
Hi, good. How are you?
Okay, good. You work with is that the VA, the Veterans Administration, Boston Healthcare,
Yes, that's exactly right.
Pharma D, and we're going to talk about elderly patients avoid medicating themselves, their errors, and very serious issue. National Safety Patient Awareness is in March 3rd to the 19th. So tell us about the importance of this, and it's very important.
It is important. One of the things I've learned along the way as a pharmacist working with older adults is just how hard, how challenging it is for these older adults to take their medicine safely, and especially when cognitive difficulties are involved.
I agree with you immensely. I just recovering from a long surgery in the hospital for 30 days. Okay, I'm 63, and I have to take, for this, I have to take some colon stuff. Okay, and if you don't keep a chart or whatever, and then I think the whole thing's a little concerning. You get you get little prescriptions from doctors in their own little piece of paper. I can't read them. I don't understand. So
Yeah, it can be very, very complicated, and especially at those times when people leave the hospital and go home, it could be extra confusing because medicines often change. They add pills, they take things away. So, and especially for some of our older patients who may have problems with memory or cognition, it can be very difficult to sort those things out at home.
So what do we do? What are some solutions? And then also let's talk about the caregiver that helps.
Yeah, the caregiver really is a key piece to this, to keeping the patient safe at home. But one of the points you've already brought up, and it has to do with that medication list, but the number one tip I have for caregivers is to keep that list up to date. And this list needs to include everything: over-the-counter products, herbals, vitamins, supplements, and prescription medications. So you can then bring this list to every appointment you have, or if you do end up in the hospital, show it to the team there as well.
Okay.
And the second tip I would have is be sure to use those pharmacists as resources. So they're in all settings: clinics, hospitals, health systems, community pharmacies, and they truly are medication experts.
I agree with you. I love my pharmacist. I love all my pharmacists. I speak to them very often, to be frank with you. And in fact, I see here in New York. I go to Siri Pharmacy right on Flatbush Avenue. But I used to always go to my local guy in town, and even growing up, we had my father's store was next to a pharmacy. So, I mean, they now have even signed consultants, consultation.
Yeah.
Is that new and big and important?
Well, what it is that there's just many, many jobs pharmacists have, and many people do associate kind of the community pharmacists. But there are pharmacists in all different settings, like you mentioned, maybe consultants who work more in long-term care or nursing home type populations, but then in the hospitals and the clinics and other health systems, pharmacists are really all over the place.
Well, the pharmacist, I was in the hospital, and they kept to say, well, we have to go down to the pharmacy. So did they literally have a pharmacy in Roosevelt Hospital?
Well, I can't speak to your exact hospital, exactly how it's set up, but there are pharmacies in hospitals, and what the pharmacists do is make sure patients get all the right medicines, and sometimes health systems may have pharmacies where you actually pick up your prescription to then go home. So every system's a little bit different, but that's generally the way it works.
Now, say you're a home-only kind of person, okay? Not everybody is blessed with caregivers or family, right?
Right.
What does somebody do? Do they keep a record of their medicines? What should somebody do?
Well, you're right. Not everyone has a caregiver or someone that can help them out. One of the things, and based on my experience working in the geriatrics clinics, that we try to do to help these patients is first take a look at their list and see if there's any way it could be simplified. And people shouldn't change medicines on their own, but talk with the doctors, the pharmacists, to see if maybe the list could be streamlined a little bit to make it easier. Is there a 3 times a day medicine that could be taken once a day instead? So things like that to make it safer.
Oh, that's a good suggestion. Okay, let's take a second with if you don't mind, because the veterans of our country are very extremely important. And how's the healthcare system for veterans in that sense of getting the needs met?
Well, from the pharmacy standpoint, what I can say is I do know the VA has many innovative pharmacy programs. There's pharmacists all across the country at VAs. My experience, however, is really limited to where I work, which is the Boston VA.
Okay. Now, there's some statistics that were supplied to me, like with how many people have Alzheimer's, 5.1 million, and 65 million, or 29% of the U.S. Have people take care of others, caregivers, I guess.
Yeah, so it's a big population, and one thing to think about is as the population grows older, those numbers continue to go up.
And then there's like 15 million unpaid caregivers. It's a serious. I think 1 out of every 3. I think I never statistics heard that has a disability.
Well, taking care of somebody, taking care of a loved one and their medications, especially as people get older and have cognitive type difficulties, it is very challenging and can be overwhelming for people. So what we recommend from the medication standpoint is see what you can do to go use your pharmacist as a resource to help with those medication issues.
Now, when you say cognitive, what do you mean by cognitive? In what sense are you speaking?
So cognitive, you can think about that in the way to think about the change in the brain's ability to store, process, interpret information. And it's not just memory. So many people think about cognition as just memory, but really it's attention, planning, problem solving, and memory. So many domains, and all of those things are important to take medicine safely at home.
Okay. And tell us about your organization, the ASHP.
Yeah, so ASHP is the American Society for Health System Pharmacists, and that's one of the biggest organizations we have as pharmacists. And I'm here today with them, and one of the things we'd like to share with your listeners is a website that we have called safemedication.com, and that all comes back to keeping that medication list up to date.
Okay, what is it called again? One more time.
The website is called safemedication.com, and what you'll find there is a tool called My Medicine List to help patients and caregivers get started with creating that important medication list.
Oh, that's great. All right. Anything else we should share with our audience?
The last thing is, I encourage caregivers to really seek out and use their pharmacist as a resource.
I second the emotion. All right. Thank you very much.
Thank you.